Judy, thank you first of all for taking the time to do this interview with us. And I want to kind of go back in time. I know you're here now for your knee, but I wanted to go back in time because we missed it 8 years ago when you're here for your shoulder. And what I want to do is have you go back and tell me and the folks that'll be listening to this, what were your expectations after you had that pretty severe rotator cuff surgery? Remember, you pulled 2 tendons from the bone. That's pretty severe. So you had the surgery, and 2 days later you showed up here in our doorstep. And what were your expectations?
Well, before surgery, my surgeon had said, now you will have to follow up with physical therapy.
Okay.
So I was talking to folks, trying to find out what, and every single person said, oh my gosh, they're going to kill you. You think that surgery's bad? You just wait till they get a hold of you. They're going to pull your arm. You're going to think you're dying. You're going to wish you were dying. Worst thing is I was talking to a nurse, and she put her hand on her chest. She said, oh, God bless your heart. I mean, a nurse is telling me that about physical therapy, and I'm thinking, okay. So I brought my husband Mike for the first visit because
was that for backup?
I was sure it was going to have to be carried to the parking lot. And I was just so nervous, and I'd saved back a pain pill because I knew they were going to kill me. So I took that pain pill before I came. Had Michael right there by my side. And we walked in, and you introduced yourself, and I wanted to, go ahead and get on with the therapy, And I hopped up on the table, and we had a little situation, and then you gave me some education about it. And it was a total waste of a pain pill.
And why was that? Because I remember exactly when you said that. You were laying flat on your back. Mm-hmm. I had instructed Michael on how to bring your shoulder out to your side, how to bring it up over to about, head length, if you will, or side of your head.
Right.
So it wasn't too far. And we brought you out into some rotations, and it was all non-painful.
No.
And so then I had Michael do that, and I'm standing right over you, looking down at your head, and you looked up at Michael and said,
that was a waste of a pain pill.
And I said, what are you talking about?
Yeah.
And then you said, everybody. And then what did I say after that?
You were just so upset because you want people to know the truth.
Yeah.
And the truth is, everything that's done is done with great care, with great knowledge, and they instruct you. You taught me.
Right. And Michael.
And Mike. About what my situation was, what my shoulder and what it needed. But the thing that I think is the telling is when I went back for a follow-up visit with my surgeon, Dr. Jack Steele, who was wonderful. And he said, it is wonderful when you have the right therapist and the stars align. He said, because then it's successful. And he was telling me that what he does must be accompanied by the right physical therapy.
Well, absolutely. And if you don't have the right surgery or the right technique is not done on you, and of course Dr. Steele did, then we're really hampered here. We probably never had the outcome. But I remember the first thing you said to me is, I'm a school teacher, and my husband teaches right across the street from me, and we're in Canova, and I'm very demonstrable. And I've got a smart board, and I've got to be able to get back and use my arm. So those were your goals.
Yes.
And I didn't know what a smart board was, and so you educated me what a smart board was. But the point is, we used Michael to be your best home therapist ever, to save your visits so that when it came time to really start using your muscles and strengthening your muscles and getting back to using that smart board as you wanted, we had those visits available.
Right.
We didn't waste them on just passive stuff that Michael could do. And so I remember telling Michael, I got kids in college still, Michael. I don't need you hanging your shingle out. I don't need competition. But he was a great therapist for you. Right. And so tell me about your outcome. Were we able to meet your goals?
Absolutely. Still, it was done so well that all these years later, I don't have any issues with it at all.
That is beautiful.
Never since the day I left. But even like when I'm doing knees and things, one day for a pre-op visit for Dr. Ali, he was going to do my knee, I came in on a cane and I left with a cane on my shoulder.
Wow. Wow. Well, that's that's special. Who saw you that time? 'Cause I don't remember seeing you.
I think it was Derek.
Oh, it was Derek? Okay.
Derek.
Well, I know you're back now and working with Derek, and we appreciate the fact that you had such a good experience with us the first time, even though everybody told you that we're going to kill you. And I remember asking, I said, well, where are they going to get their therapy? Because it's not here.
No.
And with that, what I did is, I've been doing this now for 43 years. And I said, that's it. I'm sick of hearing this. And so I hired our marketing guy to come in. And because of you, we did an introductory DVD for every patient that comes through any of our facilities, so that they get a welcome and an expectation of what to get. And then at the very end, when they're ready for discharge, we give them a thank you and tell them, go out and tell your friends and neighbors and relatives and your doctor, because people don't know what physical therapy is until they partake of it. And I just heard this recently. Not less than a month and a half ago, a young lady fell and broke her ankle right down at the top of her ankle bone right there. It was pretty severe. So she came in, I could tell she was a little leery. When I walked in the room, kind of reminded me of someone here. And I was just talking to her, telling her what I was going to do, explaining things to her. And so we went through all the treatment and everything. She says, well, that wasn't bad at all. I said, what do you mean? She's, oh, everybody told me, you'll go to therapy once and you'll never go back. And again, I'm saying, where are they going? I don't know where they're going, but it's not to Premier Therapy.
Not Premier.
And I appreciate everything you've done over the years and telling all your friends, neighbors, relatives. You tell everybody come to Premier, as I told you, you're now retired, but we should hire you to be a marketer for us.
Well, everybody here is, from the time you walk in the door, the girls greet you, they know your name, they're so kind. The techs, if you're doing something that's a little tough, they start talking to you to get your mind off. Beautiful. So it goes through a little easier. The knowledge, everybody here is very knowledgeable, and they just do everything they can to make your visit great. Wonderful. And even a couple of them are trained now, so that they know when I'm at the end of my visit, they know I like a little cup of ice. So they go and get, I don't even have to ask anymore. They just go and get it. Here you go, Miss Judy.
You have your own personal therapist.
They just accommodate you in any way they can.
Well,
anything.
The only thing that'd be better in this interview is to have Michael here with you.
Right.
And that's the only thing. So you tell Michael I missed that, because I was so proud of him, because he took right over not knowing exactly what to do, and he's working with his wife. You've had a really tough surgery on that shoulder. And shoulder surgery is tough for a lot of people. And I'm sure he was kind of tentative what he was to do, but he made it look simple, and he did great for you.
He was comfortable because you had instructed him, and he felt comfortable because he felt that he knew what he was supposed to do, and he didn't go beyond.
And I could never forget either, because I remember you both taught across the hallway from one another. Now, who taught 4th grade and who taught 5th?
He's 4th, I was 5th.
Okay. All righty. Well, Judy, thank you so much. We appreciate you and Michael so much, and I thank you for the interview today.
Anything I can do, friend.